Welcome back. Back with us today is Dr. Reagan Tilley, functional family physician who runs a direct primary care office in Kansas. Welcome back, Dr. Tilley.
Thanks for coming back, Jessica.
So we've talked a lot about trauma and how that is impactful on our health, how if we have, and trauma can be defined as something big like a car accident or the death of a loved one, or something smaller like a loved one who's kind of nitpicky on us, and a whole bunch of stuff in between, how that can be impactful on our health and well-being, such as autoimmune or blood sugar or other symptoms like fatigue and all.
Right.
And so I'd love to talk with you about how is that trauma is actually manifesting in our body, and what can we do about that?
Sure. So when we think about trauma, oftentimes it's accompanied by a lot of emotion. And what we find, people who process emotions well versus people who kind of get stuck in the experience of the emotion, that's kind of the difference between who's resilient and who struggles to overcome or get through hard things. And, in functional medicine, they teach us that everything starts in the gut. Okay, so when we go down that path, I have spent years with functional medicine, and I started to ask, well, if it all starts in the gut, why is it in the gut? What is the deal?
Yeah.
What goes wrong in the gut? It's not just our microbiome. It is our microbiome, but not just that.
Yeah.
It's the emotions. When you get scared, when you have a sense of foreboding, where do you feel it? You feel it deep in your gut. Like you get sick to your stomach, you get queasy, you get butterflies, right?
Yes.
This stuff starts to act up, and that's our neurotransmitters, the things that create emotion, activating our body. And we have 300 times the neurotransmitters in our gut than we do in our brain. So that led me to the question of how do we heal the emotions, right? So if the emotions are the impact that led to the susceptibility in the gut to allow illness to then ensue, that's where it made me very curious about emotions. And we've had wonderful teachers through the years that help us identify how to cope with emotions. Some of you may be familiar with Bessel van der Kolk's book, The Body Keeps Score.
Yes.
And it, follows the journeys of several wounded people. And predominantly his book is founded on psychology.
Okay.
And the study is the folks who are struggling with mental disturbances like depression, anxiety, PTSD, and things like that, and what physical manifestations are they having. And so that is one of the books that I've investigated. Then there's another book that's a little bit more on the, I don't want to say woo-woo side, but more on that spiritual side, called The Emotion Code. And it's how stuck emotions can create pathology in the body. And that doctor's approach to healing emotions is much different. It's not drugs, it's not psychotherapy, it's not go exercise, eat this, drink that, that kind of thing. It's more of a experience of we're releasing the emotion. And he describes a technique that he teaches his practitioners to use to allow the body to release the emotion through the meridians of the body.
Okay, so the meridians are from traditional Chinese medicine, and that's where energy is flowing
Stored
through
and
everything. So can you teach us this technique, understand that you should do this, you should speak with your provider before taking on anything. This can be, I would like you to tell us about how this technique is performed, more than teaching. You need to be under the care of somebody who is educated in this space, because I'm sure when we're releasing emotion from the body, we can sometimes be surprised with the size of the emotion we can release.
Yes. So the actual technique is very simple. And so people use muscle testing. You might see people dragging their finger through a circled ring, or they might have somebody hold out their arm and press on it. And that is something that's maybe misunderstood or not well understood by the mainstream medicine. But there's a lot of research in it and a lot of study in energy. And it's not the same technique, but we will be getting to that soon. But the technique that we're using to clear this emotion happens to be running magnets or your finger from your forehead to your tailbone down your prime meridian, which is very different. It's unusual, but it releases that emotion quickly.
Well, we are electrical beings.
Exactly.
So it makes sense.
Yes. So it's basically a rebalance of that thing. So just a short little anecdote of this healing. This was in a little bitty person. So I use a pendulum for my intuiting the problem. And what we found is that there was a emotion that needed cleared, and it was inadequacy. And then I had this feeling in this little tiny body, how does this little 2-year-old feel inadequate? And we determined it was a maternal inadequacy. The mother had inadequacy and it was projected onto this little one. So we released this technique. And at the end of this technique, this little 2-year-old did this, like released it through this deep sigh. And she was happy as a lark. And so it was a very interesting observation that your body will release. You don't have to experience it. You don't have to feel it. You don't even have to know what the emotion is in this technique to clear it. So this is a great way to work with folks who don't know what the emotion is. The SANE technique that was brought up on the screen just a moment ago is something that we do to address emotions that are big. The emotions that we know, the ones that just keep driving us.
Maybe we can get that back up on the screen.
Yes, and so the SANE model is a way to handle those big emotions. So you're going to stop. You're going to acknowledge this emotion is there. You're going to identify, oh, I'm feeling angry, or I'm jealous, or I am lonely. It can be any emotion, but it's the big emotions that seem to stop us in our tracks and keep us from moving forward. We're going to allow it. So we're going to be like, okay, I'm angry, and I'm going to let my body feel all of the anger. I'm just going to be angry in this moment. And then you're going to investigate. How is it showing up in your body? Are you clenching your fists? Are you grinding your teeth? Are you like talking through a tight-lipped mouth?
You're feeling it
your
somewhere
heart
in your body.
Yes, where? So, I mean, I know you go through somatics with your clients as well. So what are some things you've had patients notice when you're going through, like, feeling the emotions in their body? What do they tell you?
So I'm really good at somatics. I'm noticing where things are in my body, and it's been years of work, so don't expect this to happen immediately for you. But like if I'm feeling a certain kind of way, like upset or angry, if I can tell you right away, like I'm feeling it right here in my chest, or I can feel it in my stomach, or I can feel it like between my shoulder blades, or like right in the middle, like at the bra strap area. That's frequently where I can feel different emotions. And so I explain to people what that can be like. You know, this is how I'm feeling, and this is where it is. And then I notice it, I pay attention to it, so I localize to it, and then I take something called the observer lens. So I basically try to not be in that emotional state of feeling emotion. I look at myself from the outside, like just if you were to look at that discomfort, like right in the core of your belly or something, and just pay attention to it and notice that it's present there, and then just breathe deeply in and out, and then watch it slowly dissipate. And I don't associate it with, this person made me mad for whatever reason. I don't. I simply then go that direction. And that's the process that I walk our clients through.
And so the investigate is exactly your
where
observer.
is it?
Yes.
Where is it?
What is it doing in your body? Are you getting reflux? Are you getting gas? Are you like feeling like your mouth is dry? So this is that investigation. And then we have this identification. Just like you said, you're not attributing it to any one thing, because as soon as you do that, what does it do? It gives that power to that external force. So what you want to do is you really want to be more like the movie director, and instead of the play actor in it. So what you want to do is kind of see what it's doing, maybe redirect it, like, you know what, we're going to do this from a different angle. Maybe anger's it's not the right approach. Maybe you're feeling inadequate. Maybe your anger is the thing that your brain and body turns on first because it's the thing you're most familiar with. And that's the other thing about emotions, is our brains like to do things the easy way. Our brains are actually really lazy 2-year-old toddlers that like to throw tantrums. So that's really what your brain is. We have this front, our forebrain gives us that higher executive power, but we typically live in that toddler tantrum 2-year-old stage. And what happens is the brain doesn't want to work hard, so it's going to do what it knows best. And so if you live in a space of anger, something you're very familiar with, or depression or inadequacy, that's the loop that your brain says, this is easy, we know this path, so we're going to go down this path again, whether it's the right way to go or not. It takes a lot more energy for the brain to create new pathways. So when we go through this technique and we do this healing process of observation, non-identification, and just really allowing ourselves to feel it but not become it, we're starting to break that loop that is going on in our brain, so that we can reprogram the actual emotions that are warranted. Because sometimes anger is not the right response, but it's the easiest response. And so if we can go in and really think about what we need to do next and how we want to respond, we can start creating those new pathways before we get stuck in that emotion we don't want to be in anymore.
And you do this over and over and over. You teach people how to do it so that they can stop, like feeling a certain way, stop and recognize it, find out where it is, and then investigate, and then kind of do that observer lens.
And I like people to play act it a little bit. I want you to do it when it's not happening, because it's a lot harder to respond in the moment, in the heat, than it is to kind of play act it and like, oh, wait, I don't want to be angry. This is a time where I want to feel vindicated or justified. And those are a little bit more positive emotions or positive feelings versus anger.
There's nothing wrong with feeling the emotions. It's just that we're trying to help people find a way to express themselves better, and then be able to collect themselves into their thoughtful space of working things out.
Right. And sometimes it is finding that new emotion, the one that does serve you better.
Yes. Yeah, that's wonderful.
Yeah.
I love the work that you're doing.
Yeah. We could go on for hours.
I know we could, and I know you'll be back next week. Will you please let everyone know what you're working on and how they can find you?
Sure. Yes. So I own a direct primary care family practice, but we come at it from a functional mindset. So you can find me at wholehealthmhk.com. I also run an online group program to bring you into your highest self, to release mental, emotional, spiritual, and physical weight. And that's the quantummetabolicreset.com.
Thank you again for coming. I'll see you next week.
All right.
Thank you for watching, and please return after these messages for our next guest.